Hello, hello everyone. Myself Himani Sharma from RPIIT campus. In today's class, I discuss about the management of patient with oral and esophageal disorders. There are the stomatitis, gentle plaque and caries, gangliositis, periapical abscesses, periodontal abscesses, parotitis, sialadenitis, acalysis, and hiatal hernia, esophageal cancer. Stomatitis, inflammation and ulcer of the oral mucosa, causes viral infection, herpes simplex, bacterial infection, fungal infection, candida, albicans, HIV, chemotherapy to treat the cancer. Mechanical trauma, example are the cheek biting, irritant, example are the tobacco or ill-fitting denatures, nutritional deficiencies. First is the stomatitis. There are the hepatic stomatitis. In this case, type are the cold sore, fever, blister, herpes simplex virus. Causes manifestation initial burning at site, clustered vesicular lesions on lip or oral mucosa. Treatment is the self-limiting acyclovir, famciclovir and the velciclovir to shorten the courses. Next is the ephthus ulcer, canker sore, ulcerative stomatitis unknown and may be type of the herpes virus. Manifestation is the well circumscribed shallow erosions with the white or the yellow center encircled by the red ring less than the 1 centimeter in diameter. Treatment is the topical steroid ointment, amlexonox, oral paste, epthesol, oral prednisone, fluconazole, and the diflucane ketoconazole for the candida albicans, creamy white fruit-like patches, red erythematous mucosa, ketoconazole and the clotrimazole troches, nystatin vaginal troches or mouth rinse. Next is the necrotizing ulcerative gangliositis and infection with the spirochetes and the bacilli or the systemic infection, acute ganglial inflammation and the necrosis, bleeding, halitosis, fever, cervical, lymphadenopathy and oral penicillin for the treatment, warm, half-strength, peroxide mouthwashes can use. Oral mucositis are the damage to epithelial cells and stem cell in the submucous caused by the chemotherapy or the radiation therapy. Erythema and the inflammation of oral mucosa, painful, irregularly shaped ulcerations, initially superficial, progressing to deep ulcers that may be confluent, overlapping with one another, pseudomembranes covering ulcer, tissue necrosis with spontaneous bleeding, potential sepsis, and there are the regular oral hygiene with the brushing and flossing, saline or sodium bicarbonate solution, mouth rinse after and between the meals, gel clear mouth rinse before the meal for analgesia,